Hello, everyone. Welcome to our last seminar of the season for the Canadian Association on Gerontology. I'm Laurie Weeks, and I'm a professor at Dalhousie University, and I'm the vice president of the Canadian Association on Gerontology. And these webinars are one of the areas of my responsibility for organizing them. So we are very happy to have 3 student award recipients with us today who are going to each share about their work with you. You will be muted throughout the webinar, but you're more than welcome to post questions in the chat room. So each of the student presenters will present, and then at the end, we'll have a time for questions and discussion. There will be captions on the screen, as you can see, and this session is recorded, and the recording will be posted on the Canadian Association on Gerontology website, but we just wanted to make sure that you know it is recorded. And the chat room discussion is also recorded as well. I find with other webinars, people sometimes post links and resources, so it's nice to have a record of those. So that's recorded and will be posted as part of the recording. So I'm very happy to first introduce to you Lucy Kerwin, who will be our first presenter today. Lucy is a PhD student in the Department of Gerontology at Simon Fraser University in Vancouver. She has been working as a care support worker since 2017 in a community-based long-term care setting and has continued to work with older adults in care and supportive roles to this day. Lucy is passionate about promoting equitable health and social care access for all older adults and is especially dedicated to working with and advocating for older adults who are aging without familial or informal caregiving assistance. Lucy currently works as a research coordinator within long-term and residential care in BC and volunteers within information and referral and socialization outreach roles in Vancouver. So Lucy, welcome. I invite you to share your slides and you'll have about 15 minutes for your presentation.
So thank you so much, Lori, and thank you everyone for joining us today. As Lori mentioned, I'm a PhD student in the Department of Gerontology at Simon Fraser University, and I'll be presenting today on some work that I'm doing as an early stage of my dissertation work. I'd like to acknowledge my co-authors for the work that I'll be presenting today. So Indira Riadi, Kelly Teo, Ryan Churchill, and my supervisor, Dr. Theodore D. Costco. I'll be presenting today on a scoping review I'm conducting on barriers in health and social care access and navigation for elder orphans. So just a little bit of an overview of today's presentation. I'll be going over the background and context leading to the development of this review, and then some of the methodological choices that we've made in conducting the review, such as the criteria for study eligibility, development of the research question, the information sources, screening processes, and then I'll get into the early results and preliminary comments and thoughts. So in providing some background to this issue, it's well known that family members have traditionally supplied informal care in later life, as this continues to this day. This care can come in a variety of forms, including assistance with personal care and minor medical procedures, administrative tasks, as well as social and emotional support. But globally and within Canada, social and demographic trends such as family mobility, divorce and step-family formation, declining fertility and intergenerational ambivalence or declining filial commitment are deteriorating the support portfolio for many older adults. In a 2016 publication, Dr. Carney et al. Called light to this issue, in which they identified this vulnerable population as elder orphans, aged community dwelling individuals who are socially or physically isolated without an available family member or designated surrogate or caregiver. This population has primarily drawn the attention of the medical community in consideration that it's often a preceding stage to individuals becoming unbefriended patients in later life, in which they lack both the capacity to make their own informed health decisions as well as a surrogate decision maker. So in conducting this review, what we wanted to find out was what are the barriers encountered by older adults aging without informal or familial support or elder orphans in accessing needed services and navigating current health and social care systems. And an additional sub-question of what are potential facilitating factors in identifying and addressing this population's barriers in accessing defined services. So we chose to undertake a scoping review as opposed to a traditional systematic review. So a traditional systematic review is typically applied within health research to identify the effectiveness of certain interventions in quantitative research, but it's incongruous with a broad healthcare delivery research question such as the one that we are seeking to answer. So it maintains the rigorous approach of a systematic review in which the search strategy is documented and all stages of the review are documented quite thoroughly, but it enables the review and synthesis of a range of evidence. So it includes qualitative and mixed methodology studies, as well as often gray literature, which we didn't undertake for this review. We followed the methodological framework put forth by Arksey and O'Malley, and further developed by Levack et al. And the Joanna Briggs Institute. And notable here, so I won't go through all the stages just for the sake of brevity, but we did define a research question, explicit eligibility criteria. We planned a search strategy, conducted the search, selected evidence, and are now undertaking the extraction and analysis. Notable within Arksey and O'Malley's framework is an optional stakeholder or key informant consultation. And this serves to, once the data is extracted and the analysis is conducted, to present the findings to individuals who would be considered topic experts or key informants in the area in order to confirm or review findings or call to light future research gaps. So this is actually planned as a secondary study within my dissertation plan. So we developed a research strategy based on the population concept and context recommendations of the Joanna Briggs Institute. And here I have an overview of the search strategy as we developed. It was quite comprehensive. We did refine it based on the database used. So this is just an overview of the keywords that we used within the search. Examining elder orphans, barriers and facilitators in navigation and service access, and then health and social care service context. We developed explicit inclusion and exclusion criteria for the search, so to determine the eligibility of studies for inclusion in the review. I won't go through all of them again, but I will just touch on the ones that I have highlighted here. So data to be included within the review, publications had to have a date of publication from January 2005 to the date of review commencement, which we started in February. And this criteria we implemented in consideration that the term elder orphan actually first arose in early 2000s in lay press. It made its first appearance within academic literature in a nursing journal article in 2005. We only included studies with participants whose primary residence was an environment not providing, we excluded studies involving participants whose primary residence were environments providing impromptu access to 24-hour care. So this would be individuals living within assisted living environments or long-term care settings. So this was something that came up within when we published the protocol for this review. This was called to light by one of the reviewers questioning why we implemented this criteria. And this was in consideration that the barriers and facilitators of care access and navigation experienced by those dwelling within the community setting as opposed to long-term care setting would be different. And we wanted to take a look and dig deep into those barriers experienced by older adults while they are community dwelling, which may facilitate their early institutionalization. Additionally, we in consideration of how we might find studies which focus both on elder orphans and other groups concurrently, we only included publications of this nature if we are able to extract the findings specific to the elder orphan group. So there was one study that we found that included both social workers and individuals who would be considered elder orphans, but because we were able to extract the findings specific to elder orphans, we were able to include this publication. So in terms of methods and information sources, I first conducted a pilot search to facilitate keyword identification in PubMed and Scopus. And then we systematically searched 6 electronic databases, which are listed here. In terms of supplementary sources and strategies, we searched reference lists of all included articles, and additionally conducted hand searches of the following key journals: Age and Aging, Journals of Gerontology Series B, Journal of the American Geriatric Society, and the Gerontologist. Screening for article inclusion was conducted in 2 different stages. So first in title and abstract stages. This was conducted by 2 reviewers. So first we piloted our screening tool. Again, each record was screened by 2 independent reviewers. Any conflicts that arose in regard to eligibility for inclusion in the study were resolved by discussion or consultation with a 3rd reviewer. Any records that were flagged for inclusion within this stage then moved to the 2nd stage of screening, where full texts were retrieved. And then in the full text screening, the screening tool again had been piloted. Each full text was screened by 2 independent reviewers. And again, any conflicts were resolved by discussion or consultation with the 3rd reviewer. And then records which passed this stage of screening were accepted for the review and passed to data extraction. And here we just have an overview of the search and study selection flow. So notable, we conducted the systematic search within the 6 databases, and the additional hand searching of the key journals yielded no additional articles. Once duplicates were removed, we yielded 704 articles for potential inclusion. The inclusion and exclusion criteria were then applied to title and abstract review. We excluded 638 articles, yielding 66 full text articles to be assessed for eligibility. We additionally reviewed 290 additional articles from reference lists of eligible articles, excluding a total of 350 articles and including a total of 6 articles. So now we are undertaking data extraction, which is being performed by myself, the lead author. The extraction form was developed in Excel and drafted in consideration of Joanna Briggs Institute Manual for Evidence Synthesis and reviewed by the research team. In terms of the data that we are extracting, it's inclusive of the article details, details specific to the sample, including demographics, living arrangements, gender, ethnicity, cultural status, and then additionally barriers to care access, navigation identified, and facilitators of care access and navigation identified. And we framed the data extraction using the behavioral ecological framework of healthcare access and navigation. And additionally, we had chosen an alternative model for this for framing up the data extraction and synthesis, but we found that it wasn't comprehensive enough in nature. So this is the model that we're using. It's a model developed by Miriam Revicker in 2018, which it synthesizes prior concepts of the healthcare access model developed by Anderson and the social ecological framework developed by Lawton. So looking at ways in which the characteristics specific to the individual, the built environment, neighborhood demographics, their social environment, as well as the healthcare environment may influence the way that they are able to access and navigate healthcare systems. and additionally considers factors specific to providers, which then would influence their health behaviors and health outcomes. So now that we have conducted the search and we've yielded these 6 articles, so I've just listed them here. I won't go into them in detail, but I do have these 2 articles highlighted here, which I wanted to discuss in identification that only these 2 articles actually use the terminology elder orphans. The other 4 articles, while they do identify the older adults as being severely socially isolated, both physically and emotionally, they don't, and without, they do identify them as being without informal support and informal care. They don't actually use this explicit terminology. So preliminary comments on what we found. None of the identified literature was conducted within the Canadian context. All studies identified used qualitative approaches. And evidently there's a lack of conceptual clarity in research within this field, as identified in the last slide. So only 2 of the articles actually use the term elder orphans, which made it difficult to identify studies that may be considered as examining this group. There was a focus of all articles identified on lived experience rather than explicit exploration of issues in care access and navigation. And this was surprising to me when the issue of elder orphancy first came to my attention, because it's so prevalent within Grey literature. So it is under consideration by myself as part of my dissertation work to conduct a supplementary review of Grey literature. So thank you. That comes to the end of my presentation, and I think we'll do questions at the end, right?
Yes, great. Thank you so much, Lucy. Yes, we will have a time after everyone's presented for some questions and comments. You're certainly welcome, though, at any time to post comments in the discussion room. So, and I should have mentioned, too, that Lucy is the recipient of the Marjorie Boyce Bursary from the Canadian Association on Gerontology. Okay, thank you very much, Lucy. We'll now go on to our second presenter in our student showcase today. We have Kristin Prentice. So Kristin, you're welcome to share your slides to get those going. So Kristin is a 4th-year PhD student in the Health and Aging stream at Western University and is a certified therapeutic recreation specialist. She previously worked as a recreation therapist with older adults in an adult day program, in long-term care, hospital, and also in community settings. Her dissertation focuses on exploring the role of leisure for older adults moving to new homes and how identity and sense of home may be involved in this process. Her passion is researching how to help older adults continue to engage in their favorite leisure pursuits as they transition through later life. And Kristin is the recipient of the Donald Menzies Bursary from the Canadian Association on Gerontology. So welcome, Kristin. You can go ahead with your presentation.
Thank you, Lori. Thank you very much. And thank you everyone for joining us today. Like she said, I'm presenting on the role of leisure in older adults moving to new homes and just what I found so far in my dissertation research. And I'd also like to thank my committee for all the help they've done so far. So I'll begin by talking about the purpose of my research and the key definitions I'm going to be talking about, the research questions that help to guide my study, the transactional perspective that I use to guide my study, the methodology I've used and the methods, as well as data analysis that I'm going through right now, and what I found so far, reflections on those findings, and the implications for my study. So as our population ages, many older adults are going to be moving to new homes that will require a change in their social and physical environments, which could create a sense of loss. And leisure has helped older adults to adapt to other difficult life transitions, such as widowhood, retirement, and health decline, and has been linked to adjusting to these changes through socialization and maintaining identity. And leisure engagement could also help older adults to adapt to moving homes through making connections, developing a sense of belonging and a sense of home. Thus, the purpose of my study was to explore the role of leisure in older adults moving to new homes and how identity and sense of home may have been involved. So the three concepts that I looked at were leisure, sense of home, and identity. And leisure is defined as a freely chosen activity that produces positive emotions such as happiness and enjoyment, and it helps to bring life satisfaction and balances health and well-being. The literature suggests that leisure is also used as a way to socially connect with others. And home is defined as the construction of the physical, social, and emotional experiences that are tied to a place over time, and it is anywhere that has meaning to the individual. It's considered a socio-emotional concept rather than a physical concept. And identity was defined as the social roles and values that a person holds or who they want to become. People perform meaningful activities in their home, which helps to build self-identity and a sense of home. And relocating to a new home can jar this process, potentially causing people to experience a change or a loss in identity. Being with other people in the home context can help older adults build meaning together and furthering their sense of home. The literature suggests that leisure can also help to build a sense of home. So the research questions I used to guide my study is, what is leisure's role in the transition into new homes for older adults, and how are sense of home and identity involved in this process, including the reciprocal relationships between engaging in meaningful leisure and creating a sense of home and identity, as well as what are the barriers and facilitators to creating this sense of home and identity, as well as engaging in meaningful leisure after moving homes. So I use the transactional perspective to guide my study, and it focuses on how the person transacts with their environment, so how they mutually shape one another over time. And it suggests that leisure is the transaction joining the person and their situation. And Dickey et al. Indicate that the environment is not limited to just the physical form, but as well as the social, cultural, and political aspects as well. So I took an ethnographic approach to my study. I was looking at understanding the culture of older adults moving to new homes in the context of London, Ontario, and how leisure might have been involved in this process. I began with a narrative interview looking to understand their leisure life story. And then the week after that, I had them do an activity diary of before they moved and after they moved, the activities that they engaged in and who they might have interacted with. And we had a follow-up interview over Zoom about that as well. And then after that, they had to draw two mental maps, again, one before their move and one after their move. But this focused on their home environment and their community around them. So where they engaged, the spaces where they engaged in leisure. And this was to bring a more of a visual and spatial dimension to the research. They also had the option of showing photos. And these photos could have been of them engaging in leisure or their home spaces or places around the community that were important to them. And we talked about that in a follow-up interview as well. I had taken, with permission, screenshots of these photos or maps and used them as a more holistic analysis in addition to the transcripts. So for the inclusion criteria, I was looking for older adults that were over 65 that spoke English, had moved to London within the last 2 years, and could participate in leisure activities outside of the home. I had reached out to real estate agents, clubs, senior centers, and other organizations that had worked with seniors. Some agreed to send out flyers via email, and some were able to post them in their building if at that particular time social distancing allowed for it. But ultimately, I heard back from one social club that was dedicated to helping me find participants. And I was able to recruit 5 people from them, and then they knew 4 other people, and that's how I got to my number, which was 12. Their ages ranged from 67 to 79, and there were 3 married couples who participated, and 2 who were married, but their spouses didn't participate. There were 2 divorced, and 1 was widowed. 2 of the couples already lived in London, but moved to another place in London. 2 had moved from rural Ontario, and then there were a few from the greater Toronto area. And 1 married couple had moved from abroad, but the wife was Canadian, and both her and her husband had lived in Canada before. Most of these participants had moved to downsize, but some had moved to just be closer to family or for both reasons. So here is a sample of one of the mental maps. This is a post-move from one of the participants that moved from abroad. And so in the middle, you can see her house and the little footsteps she took to where she went around her neighborhood with her husband and her dog. And there's also another little house to the right there. That's her sister's house. This was the only relative they knew here. And they would spend time with them. The sister had a cottage in Grand Bend, and they would go visit their cottage often, or they would take the car to go to St. Jacobs to go shopping and other areas. And in the upper left-hand corner, you can see she wrote the different spaces in a house where she did leisure. She would cook and bake on the upper level, and then she used the lower level more for knitting and TV watching and reading. So one of the first themes that I found was that identity, participants identified themselves through their leisure activities. So they would say, I'm quite the reader, or I read because I'm a librarian. And how they identified themselves seemed to be linked to continuing with that leisure activity after they moved. In this way, leisure was used as a strategy to maintain identity. They would use it to keep in contact with social circles or continue with similar leisure activities, or even adapt these leisure activities if they could no longer do the same one because they'd moved cities. Some also continued with their leisure roles. For example, one participant was a volunteer in one city, and then when she moved, she looked for something similar so that she could continue on with this meaningful role in her life. Some participants shared a leisure identity with their spouse. One participant was part of a euchre club with her husband, and she enjoyed more of the challenging euchre, but he didn't like that one so much. So she decided to not engage in that more challenging euchre and instead keep their shared identity and do this one euchre that they both enjoyed. Other participants experienced more of a role identity shift in relation to leisure. One woman's husband passed away, and then she had to move to London and became a caregiver for her father. So at one point she's doing leisure with her husband, and then he passes away, and now everything sort of changed for her. She goes from a caregiver to a widow caregiver, and she told me about how her leisure struggled at that time. Other participants use leisure to cope with other life transitions. They'd go for walks, or they'd meet up with friends for coffee, and they talk about their struggles. And another theme that was interesting was that leisure was connected to place and identity through the social, physical, and institutional environments. So in the social environment, participants said they would be drawn to positive instructors. One participant enjoyed going to jazzercise with this particular instructor because she was so positive and happy to be there and encouraging. Similarly, another participant said she enjoyed going to her ceramics class because this instructor was always very patient and seemed really engaged in teaching, and that made her want to go. But sometimes group dynamics weren't always so positive. One participant said she'd been part of a euchre club all her life, and then she joined one when she came to London, and the women that she was in the group with were more interested in treating her as a server and wanted her to serve them coffee and tea rather than have her as a player in their house. So she felt dissuaded to want to continue doing euchre with this group. And in the physical environment, a lot of the participants talked about how London had so many parks available and close by, and they enjoyed how convenient they were and how there were so many around, and that drew them to want to go walk there. Or even all the bike trails. One participant said he really enjoyed riding his bikes around. But sort of the barrier there was in the winter, sometimes they didn't feel so safe because the ice wouldn't be cleared off and they were afraid of falling. Or for the gentleman that enjoyed bike riding, he said he avoided some areas because he didn't feel safe due to all the traffic that was nearby. And he sort of had to drive his bike to certain areas just so he could ride. And some rules were put in place by social clubs, which affected some participants' leisure experiences, such as having to sign up in advance for leisure activities. One participant said this quote, "But it's it's almost anxiety producing because you've got to get in there so fast when a newsletter comes out. You've got to go in there and you've got to reserve your spot." And I thought to myself, this is not fun. You know, this is like work. She felt that the process of having to engage in leisure this way really took the fun out of it, and she didn't want to be a part of it anymore. So in each of these situations, the social, physical, and institutional environments play a role. The atmosphere, the people, and the physical environment bring meaning to them, and how the rules or regulations of the organization affect how they engage in leisure. And so the last theme I wanted to share today is that it was interesting to learn about how participants created a sense of home through leisure at home. So participants did this by making the place their own. They would redecorate it to suit their needs. If you look at the right-hand corner there, this is one of the participants' photo of her backyard. She said this was her Zen place because she had her pool that she could go swim in after work. And she had her little deck there where she would read, and she enjoyed having the nature there. And I think if you can see, there's some deer there, and she enjoyed seeing the deer in her backyard as well. Another participant had a cozy room in her house where she did her knitting and quilting. And she said what made it cozy was it was a small room, and she had a little couch with a fluffy blanket and fluffy pillows, and that's where she enjoyed spending her time. Other participants created a place by exploring London by walking through their neighborhoods or nearby parks to get to know the area or meet people. And others joined clubs or condo boards to get to know their neighbors. They explored the golf courses where they could engage in their favorite leisure activities, as well as meet new people. And for a lot of these physical spaces, participants had the goal of engaging in physical activity as well as meeting new people. So consistent with the literature, older adults maintain identity by continuing with their previous activities. It was also consistent that older adults build a sense of home by creating attachments to place in the home and community, by doing this to getting to know their neighborhood and engaging in leisure to meet others. But what was new and interesting was that all these factors that influence their leisure engagement when moving homes, like that participant whose husband passed away, what she's going through really shaped how she interacted with her environment. And as well, the environment plays a role in how older adults' leisure experiences are shaped. And the pandemic really demonstrated this, how the rules can really restrict how we engage in leisure, and provides us the opportunity as well to be innovative about how we can adapt our leisure to meet our needs. And many of my participants did just that. They adapted their leisure activities to meet their needs during the pandemic after moving. Like the participant who went to jazzercise, she had it over Zoom, and she began doing that 6 days a week. So how older adults engage in leisure to adapt to their new home can help inform policymakers and practitioners in the community, develop programs that may be able to aid in this transition. In addition, how they use leisure and spaces in the home, neighborhood, and community to establish place, and how these places shape leisure engagement could also assist policymakers and practitioners when creating programming for seniors in the community. So meaningful contributions of this research could include having municipally run programs that are designed for newcomers to the city. Could have partnering community organizations like host presentations or run services, and help seniors just to get to know each other and to get to know the city a little bit better. So overall, leisure has been seen as a strategy to adapt to life transitions, such as moving homes or death of a spouse, and they do this through maintaining connections with others, creating new attachments by contributing to building a sense of place in their home and in their community. And the environment shapes leisure engagement through the social, physical, and institutional environments. Thank you.
Great. Thank you very much, Kristin. That was very interesting. I loved your map, that map you drew in there. Okay, our final presenter in our student showcase today is Busola Adekoya. Busola, please, you're welcome to get your slides going there while I introduce you. So Busola is a registered nurse and a PhD student in the School of Public Health and Health Systems at the University of Waterloo, under the supervision of Lily Liu. And I see Lily is in our participant list today. Busola is passionate about the rights of older adults to receive quality care and maintain optimal quality of life. Her current research focuses on older adults living with dementia at risk of getting lost and going missing, and the use of innovative strategies to promote safe walking. And Busola is the recipient of the Schlegel University of Waterloo Research Institute for Aging Scholarship, awarded by the Canadian Association on Gerontology. So welcome, Busola. You're welcome to begin your presentation.
Thank you so much, Laurie, for that introduction. Can everybody hear me and see my slides?
Yeah,
Okay.
both sounds great.
All right, perfect. My name is Busola Adekoya, and today I'll be sharing my research proposal titled Community Alert Systems for Missing Older Adults Policy to Implementation. And just to kind of quickly mention that this is actually in the early stages, but I'm excited to share this with you all. I would like to start off by introducing the Aging and Innovation Research Program team members that I've been working closely with, and my supervisor, Dr. Lily Liu. She is the head or the lead of the team, and also I have Dr. Nilbara here, and I have Dr. John. So in terms of the background, what is the risk of older adults going missing in Canada? For some of us who might be familiar with the statistics already, but for those who are not, we know that 60% of people living with dementia, they wander. And this means that the risks associated with wandering behavior include getting lost and going missing. And over the years, we've been seeing an increase in the number of missing incidents involving people living with dementia. And according to literature, we know that 70% of people living with dementia will go missing at least once, with some going missing multiple times. And if they are not found within 24 hours, we know about 50% of them will end up being found with serious injuries or even deceased from being exposed to extreme temperatures, especially in this part of the world that we live in, Canada. You know how the temperature can get. And also we know from being exposed to dehydration. So the risk is actually high for people living with dementia when they go missing. And we know in Canada, first responders are responsible for locating missing persons, but the services are actually costly. They are limited, especially in rural communities. If you think of searching, that may require actually searching miles of natural landscape. And we know that the cost of locating a missing person with dementia can be as high as $1,500 per hour. So that is quite concerning if you look at the statistics here. So what is silver alerts and what would it look like in Canada? For those of us who are not familiar with the term silver alerts, I will start by telling us a little bit about it. The Silver Alert program is publicly funded, or the programs are actually publicly funded in most states in the United States. And it involves the use of social media outlets such as commercial radio stations and TV stations, as well as social media by police services to alert the public about a missing older adults. And we know that evidence on the effectiveness of Silver Alert programs in the United States is inconclusive, but because in Canada, because of the perceived effectiveness, we've been seeing a push for silver alerts in Canada. And also because of the rise in the number of older adults living with dementia that have been going, you know, the rise in the number of older adults living with dementia going missing in Canada. And in 2019, a national petition for silver alerts for missing older adults was presented to the House of Commons. In response, the government of Canada delegated the responsibility for alert systems to individual provinces. And this means that how a silver alert program will be implemented in a province might differ from another province. And to date, we know Manitoba and Alberta have amended their Missing Persons Act to acknowledge the risks of older adults living with dementia going missing and to include the term silver alerts, but there are no silver alert programs that are in place in these provinces. So what are the gaps? I will start by talking about what is in existence in British Columbia. We know British Columbia, they have, in British Columbia, there is a citizen-led silver alert system for locating not only missing persons with dementia, but those with cognitive impairments as well as autism, but no provincial act. For the BC Silver Alert program, for those of us that may not be familiar with it, it uses various channels, including social media. So we're talking about Facebook, Twitter, as well as email to alert subscribers of missing person incidents. But we continue to see a lack of association between policy and programs for community alert systems, in Canada. And this has implications for adopting as well as implementing the program in Canada. And when I'm talking about policy, I think I should be clear to explain in explaining what I mean by policy in this context. So policy means decisions. We are looking at plans. We are looking at actions as well as inactions by governmental as well as non-governmental organizations in implementing alert systems. So the conceptual framework that will be guiding my study is the policy triangle framework by Walt and Gelsen. This framework identifies 4 factors: context, content, actors, and process that should be taken into consideration in policymaking, and as well can make the difference between effective and ineffective policy choice as well as implementation. So let's start looking at the factors one by one. When we talk about context, context refers to the contextual as well as systematic factors, such as we are looking at social, we are looking at economic, we are looking at political, culture, as well as environmental conditions and historical experience that influence policy. Now let's look at content. Content includes, oh, sorry, that shouldn't be content. Content includes policy objectives. We are looking at legislation. We are looking at regulations and as well as guidelines. And let's talk about policy, the objectives. Let's talk about sorry, just one, I was a little bit fluttered by that. Okay, let's talk about actors first. We know actors, kind of just to bring us back to the center of the triangle, as we have actors include, we are looking at individuals. We are looking at not only individuals, but also we are looking at groups. We are looking at organizations that influence policy. And when we're talking about actors, actors play a key role, in fact, critical role in the policy process. The key elements of policy change are the group of actors that are involved. And when we're talking about policy development and implementation, actors, their position in power structures, as well as their values and expectations actually help in policy development as well as implementation. And the last one is the process. I was kind of way ahead myself there, sorry about that. So for the process, we are looking at the way in which policies are actually initiated, developed, formulated, negotiated, communicated, implemented, and evaluated. So the policy triangle framework can be used to better understand policy development and plan for future policy implementation. So the objectives of my study, I would like to examine policy development at local, at municipal, as well as the local, the municipal, as well as I'm looking at not only the local, I'm not only looking at the municipal, but also I'm looking at what are the sectors in the context of community alert system, the provincial sectors. For my specific objectives, I will be looking at to understand what are the factors as well as the context, the content, the actors, and the processes influencing the implementation of community alert systems at local as well as municipal and provincial sector. Also, I would like to explore the challenges in the implementation of community alert systems, again, at local, municipal, provincial sectors in Canada, and how do we enhance community alert systems in Canada as a whole. And also looking into the methods. So what are the methods that I will be employing in this study? I will be using a multi-method qualitative approach in this study. First, I plan to conduct an exploratory case study to analyze as well as gain insight into factors. Again, we are looking at what are the contents, the context, the actors and processes that facilitated the implementation of the BC Silver Alerts in Canada. For a case study, I know a case study is really is the approach because it's going to help with in-depth investigation of the phenomenon that we are looking at here. I intend to review documents. I intend to look at policies, guidelines, memoranda, project reports, official reports, as well as newsletter. I will also use a community-based, that's my second approach, a community-based research approach to build a coalition of 10 stakeholders. So we are looking at the actors and implementers of BC Silver Alerts here. I'm going to conduct interviews and focus group with the stakeholders, and this will focus on identifying how the BC Silver Alerts was implemented in Canada. And also I will ask them questions related to the challenges in implementing the BC Silver Alerts in Canada. So we are looking at the cost, we are looking at what are the technical feasibility or the technical issues that might be involved. Also looking at privacy legislation. How has this affected the implementation of the BC Silver Alerts in Canada? So in terms of my data analysis, I intend to conduct thematic analysis by Brown and Clark, 2006, to identify key themes. So for the key themes, I would like to identify what are the factors, again, that influence the development of the BC Silver Alerts. We are looking at the context, we are looking at the context, we are looking at the processes, we are looking at the actors. So the 4 factors that I mentioned earlier. Secondly, I'm going to look at what are the challenges in implementing BC Silver Alerts in Canada, and what are the ways to enhance BC Silver Alerts in Canada. And I will be leveraging existing relationship that I have with the BC Silver Alerts implementers, including from my supervisor, being able to work with my supervisor to identify who are those that would be involved in the study. And also I will be using the snowballing approach, where potential participants will help in identify other participants for the study. So let's talk about the contribution of my study. I'm hoping that I will be able to identify the association between, again, policy and programs for alert systems in Canada, a better understanding of this association. I think it's really important for us to get to understand how policy is being implemented and how this affects the implementation of alert systems in Canada. And also, I'm hoping that the findings will inform policy on alert systems in Canada for the provinces that are looking at implementing alert systems, like what do they need to do? What are the challenges based on what I identified from the case study with the BC Silver Alerts, to identify what are the challenges that could be anticipated if they want to engage in implementing Silver Alerts in their province. And also to look at what are the factors. So we talk about the factors again, which are really important. So I'm hoping that the findings will inform policy on alert systems in Canada. And another contribution of my study is to support aging in place. I know I attended an event a few days ago talking about the future of aging in Canada. And I know that technology was identified as very important in helping older adults to age in place, and also to promote or to enhance the safety of older adults. And also this study will serve as a precursor to future studies. So I'm hoping to continue to look at how do we support the implementation of Silver Alerts in Canada. And these are my references. And for the contact info, please feel free to check out our Aging and Innovation Research Program website. And you can email me, as well as follow me on Twitter or send a message. And I would like to acknowledge the Canadian Association on Gerontology, as well as the Chicago Research Institute for Aging for the scholarship, and Canadian Gerontological Nursing Association, as well as the Gerontological Nursing Association Ontario. And thank you everyone for listening.
Thank you so much, Busola. Very interesting and important research that you'll be doing. So we do have some time now. If anyone has any questions or comments for any of the presenters in our student showcase today, Lucy, Kristin, or Busola. So you're not allowed to use your well, you can try to use your microphone, but it won't work. We've basically muted everyone in this national webinar, but you're more than welcome to post any questions or comments. And Busola, Lucy, and Kristin, you're welcome to look at the comments too to see what people are posting, but I'll try to moderate this. So you're welcome to post things. So each of you three can speak. So the first, there's a comment from Kendall. Busola, can you talk a bit about the timeline of your study?
Thank you, Kendall. That's an interesting question. Good question. I'm looking at getting this done because I just started my PhD program in September last year. So I'm hoping that within 2 to 3 years, I'll be able to complete this. So that's the timeline for the study. I hope to get it completed before I finish my PhD program.
Great, thank you. There's nothing else posted. Did any of you have any questions or comments you wanted to raise, or anything in addition that you'd like to talk about? If I might, then I don't want to take time away from others. But Lucy, I know we had talked a bit about some Canadian research that has been going on, but you weren't able to include any Canadian research. Can you talk in your review that you did? Are you aware of any research in Canada that might be able to contribute to our knowledge in this area of elder orphans?
Yeah, certainly. Thanks for your question, Lori. So I know when I had sent in my abstract for this presentation, actually, Lori had mentioned the work of Dr. Stephanie Chamberlain, who's actually one of my supervisors, who's conducting her work at U Alberta. But Stephanie's work are actually around unbefriended older adults. So I think there's an important distinction there in recognizing that elder orphans refers to older adults who are living within the community and retain decision-making capacity. However, they lack that informal caregiving assistance and the option of having a surrogate decision maker if they were to lose that cognitive decision-making capacity. So at this time, no, I haven't identified any work, and why I think it was important to highlight the issue surrounding the terminology. And I actually got a question from one of the participants in direct message kind of about the terminology is the word itself, like the term elder orphans, I think is quite contentious. And I think there's a lot of pushback by various members of both the academic community and the lay community as to its appropriateness in using this kind of terminology to refer to older adults. So that is something that I would like to look a little bit deeper into. But an issue there is that I had actually uncovered literature that was examining individuals who were described as solo agers, but they would still have that access to informal support. So at first I would consider them for the review, but because they still had access to that informal caregiving support and family, then they wouldn't meet the elder orphan criteria.
It's a good example of how terminology is so important and developing clear definitions, especially when you are synthesizing existing knowledge and doing some sort of a scoping or systematic review. So that is certainly a big challenge, definitely. But obviously, an issue for any of us who have experience working in long-term care settings. So there's really a mismatch between, the experience and importance of this issue and actual research attention. So that's great that you are working on this topic. There's a question for Lucy here posted by Lily Lou. So the question is around, are elders orphans by choice or by circumstance?
So thank you for your question, Lily. This is a really interesting question, and it's not really something that I have considered, but The research that I had identified for inclusion in the review, it primarily frames the situation of late life orphancy as being sort of structurally created and enforced by disparities in access and the this is an interesting question. I'm not sure how to answer it actually. So I would say it's really dependent on the circumstance. This isn't something that is identified just as if you were to say, if somebody were to, because some of the literature that I'm reviewing, it explores the living circumstances of older adults who have relationships, they have children, they have familial relationships, but those relationships are now estranged, so they no longer have access to that support. So I think it really depends. This criteria isn't really included within that definition, but I think that's an important question and something that I'm going to consider now within my research.
I assumed it would be by circumstance, but that's really interesting to consider. There's many different contexts, right? And reasons for being considered an elder orphan. Very interesting. Kristin, there's a question here from Matt you can probably see. The question is, how closely linked are the concepts of role and purpose to identity in your research?
That's a good question. A lot of them sort of spoke about how meaningful leisure was, and they would talk about it in terms of how they engaged in it. So their role in terms of being a volunteer was a big one. I'd say about 5 or 6 out of the 12 really spoke about their volunteer roles and how important that was to them. And the importance was really emphasized by them talking about being in that environment, working with clients, and sort of that role it brought for them. And they would use a lot of that language, like I volunteer, I do this. And that's sort of how those sort of seem to correlate together, if that helps.
Yeah, no, that's great. Thank you. Busola, I'm really curious, your research that you're proposing to do on community alert systems. Have you found a place or maybe a country that has a really good example of doing this well? Like obviously in Canada, we are not doing a whole lot yet, except for some really local things you identified. Like, is there a country or an area that is a really good example of doing this that maybe we could emulate in Canada?
Yeah, absolutely. Thanks, Laurie, for that question. I mentioned earlier about the Silver Alerts program in the United States. They actually started from the United States, and I know most states have implemented the programs. Even though I said the evidence is inconclusive, it's kind of, it varies, but there are articles or papers on how the Silver Alerts program has been really helpful in some states in Canada, in the United States, in locating missing order adults. Another country is actually the United Kingdom, Scotland. I know we have the Purple Alerts, which is kind of community based. So it's not like a statewide, like the Silver Alert program in the United States. And this, the users, you have to kind of subscribe to it, and then you download the app. They call it Purple Alerts. And caregivers or care partners, they have the opportunity of uploading information about their loved ones on the app. And if the person goes missing, then this will be, the notification will go out to subscribers, and they'll be able to see information about the person, just the basic information about the person, the photo, what the person looks like, for the community to be able to locate the missing person. So we, from what I've heard, the Purple Alerts has actually been an effective app in locating missing persons with dementia. So I think it would be nice, like I said, I'm still in the early stages of my proposal, but that might be another angle to look at, kind of compare how in the Scotland, how they're able to use the Purple Alerts, or how they are continue to use the purple alerts in locating missing person, and just to kind of see the success of the app in locating missing persons.
Yeah, it's always interesting to see what's happening in other places. There's another question here for you, Busola. I was wondering this too. So Lily said, are there contentious terminologies in the research you're doing? So I'm assuming that might be related to this concept of silver, maybe. Have you come across that? I mean, again, it's this issue of terminology and what's the appropriate terminology that's a consistent issue across many different areas.
Yes, absolutely. I think the silver alert itself, even though I mentioned that there is a push for the silver alert program in Canada, we know some people are still kind of questioning that is actually the right term for us to be using. Is it actually, should it be the silver alerts, or maybe the community alert systems? Systems are more appropriate compared to just the silver alert programs, because with the community alert system, it's kind of more community based, and it sends notifications to people within the geographical location where the person maybe went missing in real time. And that might kind of be more helpful compared to just the silver alert program. So, and I think the silver alert itself, it triggers an ongoing debate on, is it actually what we should be looking into? And even the term wandering itself, I know, especially from caregivers and people living with dementia, there have been concerns about wandering because of the negative connotations associated with it. So yes, and to answer your question, Lily, yes, there are contentious terminologies, the silver alert program itself, even the wandering behavior itself. Yeah, we just need to be careful about how we use those terms, and maybe kind of go back. I'm hoping to do a scoping review and hopefully look back into all these terminologies and see how they are being used in our day-to-day activity and what they actually mean, not only to health professionals, but even people living with dementia as well as care partners. So lived experience of what this term actually means. I think it's really important to go back to that.
Yeah, it is challenging, the terminology, right? So that's great you're going to look at that more in depth. And maybe I'll ask one final question that's posted here. Kristin, I was wondering this too. So this is a great, this concept, and with your background, you're very uniquely, I think, able to address this concept. So did you find participants whose leisure activities are more like work to others, even in their senior years? I was thinking when you were talking about the concept of what I like to think of as productive activity versus leisure, which sometimes older adults are more conducive to doing that type of thing. Anyway, what would you like to say about that concept of leisure versus work?
Well, there are a lot of definitions of leisure out there. So I purposely didn't define it for participants to let them have their own idea of what was leisure for them, what they chose to do in their free time. And so a lot of them would say, like, I like to cut the grass. Is that leisure? And I just, would let them say what they found was meaningful activity to them, right? And one participant said that he really enjoyed like doing maintenance on the house. So for some that'd be considered work, right? But to him, it's like, I really enjoy doing this, and that's what I choose to do in my spare time. So
yeah, it's interesting, isn't it? I think that has a lot of implications, like with your background, in recreation therapy, how to engage people in a meaningful way. I think so. Yeah, that's really interesting. Thank you. Well, we've come to the end of our hour, plus perhaps a couple minutes, but I really want to thank the three of you for agreeing to be part of what I think is our first student showcase in terms of a national webinar. So thank you all very much for agreeing to present and to share the hour. You all did great with really synthesizing your points and sticking to the time. So I really appreciate that. And I think you've presented some really interesting things. So thank you all very much for participating. And as I said, this will be recorded, and you're welcome to access the recording on the website of the Canadian Association on Gerontology. So thank you, Busola, Kristin, and Lucy for participating, and for everyone for joining in our webinar today. So thank you all very much, and have a great day.
thank you.
Thanks, everyone. Bye.